South Africa's healthcare system is currently facing a critical challenge with over 1,800 qualified junior doctors unable to secure employment due to budget constraints. The South African Medical Association has expressed deep concern over this issue, warning that the inability to absorb these professionals into the public health sector could exacerbate existing service delivery challenges. Now we speak to Dr. Mvuyisi, who joins us now to unpack this further. Dr. Mvuyisi, good to speak to you. It's got to be extremely concerning for you that these 1,800 junior doctors remain unemployed. You and I have had this conversation for several months now.
Good afternoon to you, Hugo, your crew and your viewers, and thanks for having me. Yes, indeed, we've been talking about this a lot. We know now that we still have 1,800 junior doctors, those that have completed their community service, who are still at home and unemployed whilst, there's a dire shortage in the hospitals. But Hugo, I think we do need to highlight this thing that, junior doctors are a backbone of the healthcare system in the country. Usually they work in areas, in the rural areas, underserved areas, very urban areas. And but this comes at a cost, because usually they are overworked, and also, there's a challenge in the hospitals of poor leadership and all these things. Now the challenge is that this is not only a problem to the junior doctors who are sitting at home. It is also having a huge burden on the current staffing, those that are in the system already. And not only them, but also the patients that are being treated because of these challenges.
Now, one can only imagine the ripple effect of 1,800 junior doctors remaining unemployed. How many doctors are we churning out every year is the question. And this number obviously is going to continually grow.
Yes, most of the time we're sitting at around 2,000 or so doctors that are trained, at the output. But the problem is that even though we have these doctors coming out of the training system, usually there is no forward booking in terms of the planning. How do we place these doctors? Because we do need to place them, as you know, according to the World Health Organization, we're sitting at 0.31 doctors per 1,000 citizens. So you can imagine the gap that is still out there. And also looking at the underserved areas in our country. So this is quite dire for us. And I think if we leave it like this and we're complaining about all these things, whilst at the same time we're wasting money on advertising NHI, I think we're in a serious problem.
Dr. Mzukwa, just paint a picture for us of how this number of 1,800 doctors impacts you and I, or impacts the average South African at the moment.
Okay, thank you so much. I think this is a critical question. If we have got, these unemployed doctors sitting at home, these are fully qualified, polished diamonds that are sitting there at home. We've invested a lot of money in training them. But the second thing is that, the expectation was that these doctors are going to go in the underserved areas, peri-urban areas, even the urban areas, for example, where there are no few patients there. Now, if you do not have those people coming in there, it means the hospitals will continue to be overcrowded. And also, the impact of burnout to those that are working in the system. And that burnout would lead to other problems where you find that doctors are leaving the system. Those that are already in the system, they leave. If, for example, you look at the study that was done by Dr. Stodel there in the Western Cape Red Cross Hospital, it was around 2011. It showed, the significance of burnout on the retention of skills of medical professionals, and that 95% of those wanted to leave the public sector. Now, if you have that kind of burnout, it means there will be many mistakes that are happening in terms of the management of patients, but also it means we continue to have this perpetual absence of doctors in the healthcare system. So it impacts negatively on the patient because there's no proper care in the hospitals. Even when they have emergencies, they can't be attended promptly because there are few medical practitioners, but also the mismanagement that may come out because of the shortages. Because if you are dealing with, you are in an emergency unit, there's one doctor, and there are 4 emergency patients that come in. You are going to be able to manage properly one emergency patient, and the other ones are going to die. Hence, this shortage has a negative impact on the livelihoods of patients. You know, they are going to lose their lives if we are not careful into managing the situation as it is now. Not let alone the burnout on the current staffing, the current doctors that are in the system.
Now, Dr. Mzukwa has cited budget constraints as a significant barrier to hiring new doctors. How does SAMA view this explanation?
Well, we don't believe that there is not enough money to hire doctors. We don't want to, believe that, because we have learned that there's so much wastage in the system in terms of mismanagement of funds. I've just mentioned now the advertisement of the NHI. We were told about the NHI that there's been a parliamentary process where they've been out, up and about, doing road shows out in the country. And we're told as a nation that majority of South Africans would like to have the NHI. So why do you advertise something that is being loved by South Africans if that what we're told was the truth? So that is the question. And 28 million is quite a lot to get about 20 doctors out there. If you look at, for example, the Tembisa Hospital, there's about 3.4 billion that is under investigation there. So it's just one hospital, 3.4 billion. How many doctors can you get out of 3.4 billion? You could absorb this whole lot that is out there, just one hospital. And you can imagine, you know, in all these provinces, KZN alone, for 7 consecutive years, have been having qualified audits. So it's Eastern Cape is just a mess, if I may put it that way. So these are the challenges that we're saying. There is money. The problem is mismanagement of that money.
Now, how do you have an NHI run successfully without these 1,800 doctors or 2,000 doctors that are coming out every year?
Hugo, NHI, as I always tell people, is just a funding model. And if you look at the report by ASAP, I think it was done in October last year, they made it clear that even if you come up with the NHI, if you do not resolve the issue of ethical leadership and governance, this NHI is going to fall on its face, you know, because we have a serious problem of ethical leadership and governance. We've got people who have been deployed in these hospitals as CEOs and stuff like that. They are not accountable to anyone, and on top of that, they are not. Most of them are not competent into running those because they are just deployed there, you know, as members of a political party. So those are the challenges that the system is facing at the moment. But the other thing is, the NHI says nothing at all about how they are going to be capacitating the system in terms of, you know, human resources for health, in terms of medicines and technology. You remember here in KZN, patients are being turned away in some hospitals because they are stock out of chemotherapy. So you can imagine what is going to happen to that patient. So the NHI is not really a model that is going to reform a healthcare system. It is going to collect money. Even if it collects that money, it's not sustainable because we are talking to a very small tax base that we have in South Africa. You can't have a system that is fully dependent on a tax base. It can't happen like that.
Now, final thoughts. You have a conversation with a young doctor who says to you, "Doctor, I've been waiting the last 15 months or 16 months trying to get a job. I can't get a job. The next best option is to leave the country." What are you advising individuals that have those sort of conversations with you?
Well, if doctors have been trying to get employment, they always try in South Africa in the public sector, because that's where we would like them to go. But also they would go into the private sector. We can't stop them. Some will go to other countries like Canada, Ireland, New Zealand, and all these other areas, even the UK. So we can't stop them because government has told them that they can't employ them. So what do you tell them? Do you say wait and further 15 months unemployed? We can't say that. But it's so unfortunate that South Africa is training doctors in South Africa using taxpayers' money and sending them across to other countries, to serve other countries that have nothing to do with the investment, to those doctors.
Dr. Mvuyisi Mzukwa, SAMA chairperson, speaking to us about the 1,800 junior doctors that remain unemployed because government says they do not have money to employ them.